Ladies and gentlemen, welcome back to the TCM community. And today we are talking with Dr. John Lee. Dr. Lee earned his medical degree and also his master's degree in law at the VU, Vrije Universiteit in Amsterdam. And he's worked as a specialist in immune genetics for unrelated bone marrow transplantation at the Leiden University Medical Center, and also participated in various scientific programs, associations, and publications in transplantation immunology. He also studied acupuncture for physicians at the Dutch Medical Acupuncture Association, NAAV, and in Beijing, China. And he is currently also the secretary of the NAAV, the Dutch Medical Acupuncture Association. So welcome, Dr. John Lee.
Okay, thank you very much for inviting me.
No problem, you're most welcome. And I was wondering, considering your background, why did you choose to work in the field of traditional Chinese medicine?
Well, actually, that was not a choice, because I even didn't know I want to be an acupuncturist or a Chinese TCM doctor. It started with one of the student exchange. When I was a student at the Free University, there was a exchange program between the Beijing Capital Medical University and the Free University and the Amsterdam University of Amsterdam. And so as an exchange student, I went to Beijing for 4 months, and we students from the Western universities are given the choice to select the program. So we could have done a vaccination program in China, we can do some surgery, whatever we may choose. So we, with the 11 or 12 people of us, we have decided to select a program which is not Western, which is typical Chinese. So we think, we thought we want to do something exotic. So we said, how about acupuncture and TCM? Well, the Chinese university program leader said, yeah, of course, why not? Because that is normal in our university. So we can even give you this program, offer you this program to follow the summer course. So we have done the Chinese medical, the acupuncture and the herbal and TCM. And so after I have done this, I came back, and also we have a lot of training in the Saturdays, because in China it is a 6 days working day. So we have 6 days education and practical training. And the nice thing about this, it was in 1991, and that was just 2 years after the students' revolt in Beijing. So the authorities are trying to do their best to show us China from the best, the best they can show.
Mm-hmm.
So they took us to all kinds of cultural program. We visited all kinds of museums in the Sundays. So it's actually sort of holiday. It's very nice to have actually the Sunday off means Sunday a full program with visiting museums and all kinds of sightseeings.
Mm-hmm.
Well, okay, organized by the university. And after that, I came back to the Netherlands. I graduated in medical science, and I went to the University of Leiden to work and for my training as an immunogenetics specialist. The professor told me that acupuncture is not real science. So I believed them. But after 5 years working in the University of Leiden, a colleague of mine asked me to join the Acupuncture Association. And I said, well, okay, I have done some acupuncture and TCM, but I don't have the time. Actually, it means that I don't believe in Chinese acupuncture. But he said to me, well, join our science committee, because our science committee need people from the university with their backgrounds and the scientific experience. We need someone to enforce our committee. And okay, I agree. I went I was assigned to the scientific committee. And then I discovered there was a huge amount of science papers about acupuncture. And actually, I felt like I have a lack of information about the scientific background of acupuncture, because if you study these papers, I discovered that acupuncture is actually scientific proven. So the efficacy, the efficiency, the effectiveness of the Chinese acupuncture, it works. Again, I mean, even the science papers prove that Chinese acupuncture works. It has been published in major medical science papers. These publications prove that Chinese acupuncture is actually working. And although the professor told me that it's not working, so that's the problem. And it's because nobody read these papers.
Yeah.
And that's the problem. And let's say the Western doctors, they know a little bit about acupuncture. They say, oh, there's someone that you get a treatment with needles, and then you will get better. But it's probably psychological. It's probably people believe it, and so it is placebo, etc. But the strange problem is actually that if you do a real placebo treatment, the effectiveness should be 10%, maximum 20%. That's the placebo effect. A real 100% placebo effect cannot exceed the 20%. If you compare it with acupuncture, you get at least an effect of 48%. So if you take that into account, that putting some needles in someone, it must be placebo, but it is proven to have an effect of 48%. It is a very high placebo effect. So the higher the placebo effect it is, the less likely it is a real placebo.
Right.
So, and if I'm a patient and I go for a placebo treatment, of course, I don't care why it's working. I mean, I will go for it for the 48%.
Yes, of course. Yeah.
50% chance. I mean, it's even higher than the effectiveness of the Dutch family doctor. A family doctor have an effectiveness of about 28%, 30%. And if you go to a hospital for the medical specialist, usually you have 50, 60%. But it is because based on the selection, there's a selection bias, because the family doctor already selected the patient like, yeah, you must have something with, you need an operation, you need to be treated with, and you have to treat it for hormones, for your thyroid. So yes. I send you to the hormone specialist. Yeah. This is the same as people who go to a restaurant are 100%, or let's say 80% of the people who visit a restaurant are hungry at the time they went into the restaurant. Yeah. It's not that only 10% of the people are hungry if you go to a restaurant. So right. standing in the entrance of the restaurant, like, are you hungry? Well, I think 90% of the people would say yes.
Yeah, of course. Yeah, it's the situation.
Yeah.
But so anyway, that drew you more towards looking into traditional Chinese medicine.
Well, that gave me the confidence to pick up my old books and to look at my notes and to go back to what I have done in China. And then I realized, oh, wow, I forgot a lot of things. So I've done my training again in the Netherlands for acupuncture. And then even after a couple of years, I went to Germany for an additional training for acupuncture. So because I think, wow, because these papers show that acupuncture really works and at least a 48% effectiveness, then I must study more.
Yeah.
So besides my work at the university, I did my training again for acupuncture in the Netherlands, and I started with my own practice about already 20 years ago. Acupuncture in my free time, actually on Saturdays. And so I started with my practice next to my hospital work. And after it's 20 years work at the hospital, I decided to go fully into the acupuncture. Okay. And that is because I see a difference in what I'm doing in my own practice and compared to the difference what my job, my function is in the hospital. And
I think it's great that you were so insightful about looking into the science of Chinese medicine, and then also because what we have here in the West available to us, the research is like maybe 1% that is available in China.
There are a lot of research papers in China, in Chinese, not translated into English. Some part of it has been published in PubMed. And sometimes people say, well, the quality of the research is not that good, but nowadays there are a lot of good quality Chinese research.
And especially if you're able to understand read Chinese, then there's even more available quality research.
Yeah. But that is a grading of science quality. So the quality of the science papers is usually graded in high quality or low quality. What I know nowadays is that China is catching up. So they are publishing a lot of high quality scientific papers. And if that is the case, they always submit it to the PubMed. PubMed is a sort of medical Google. Go to PubMed, you can Google practically any disease and any treatments you want to know, and you will get the latest scientific papers.
Okay. So you've also done courses in Germany and in Holland and in China. What do you think about the difference in educational approach when comparing Europe to China? Is there a difference? Have you noticed anything, or is it insignificant?
Oh yes, different. It's significant, especially in China, like TCM. It is medical education. That's all. It's plain. It's just medical education. Chinese way of looking at disease and how to treat it is completely Chinese, and it's considered to be the regular, normal treatment. And I know from the Chinese patients that they considered an operation like more alternative. So tends to move to herbal treatments or TCM treatments, lifestyle treatments, just to avoid taking medicine, Western medicine, and taking just to avoid and to have an operation. And if these TCM herbals are not working, then they might decide to go for an alternative treatment. What they call alternative treatment is then the Western treatment.
Yeah,
different approach. And if you say with regard to the education, it is part of the education. It's a part of the Chinese tradition, and Western knowledge is just added to it. So it's not add off. It's just in China we already have our own medical system. Then what we know from the Western information is just added to it.
Right. And you feel also it is not only added, but really integrated with Chinese medicine.
It is integrated. It is integrated. And because if you integrate it, this is such a large field that one have to make a decision, especially in China, after I think it's 2 or 3 years university education, one have to decide whether they go to the Western doctor.
Yes. Yeah.
Or whether you go to the Chinese tradition.
Yeah, correct. And also that's why they have the option in hospitals. If you go there as a patient, you have the option to take herbal medicine, traditional herbal medicine, or modern Western medical medicine.
Yes, and
even as a patient.
Yes, in Chinese you are an MD or an OM, Oriental medicine or medical doctor. So you will decide. You have to decide which way you have to go to. And is in Chinese is called 中医 and 西医. And 中医 means you're specialized in Chinese medicine, and 西医 you're specialized in the medicine they call Western medicine. So if you're in China and people ask, what do you do? And you said, I'm a doctor. And the next question will always be 中医 or 西医. Are you or 西医? So it's just one of the two.
Yeah. Also, have you noticed the average thickness in needles that are used in China compared to Europe?
I have noticed it because Chinese doctors tends to use a needle of 0.25, and it's quite thick if I use it on Dutch people, Western people. So I think why we use thick needles? I mean, 0.25 is quite thick. I mean, if you put it in the skin, it's a little bit more tension, and you have to use more force to put the needle in it. So I switch into a smaller needle, 0.20 or 0.23. It's a little bit smaller, and that goes better, and it works better with a less thicker needle. And I think it's got to do with the skin. The Western people, white people with a white skin, have a much more thinner skin. And if the skin is thinner, then you need a thinner needle to put in. And I know that Chinese people usually have the thicker skin. That is one of the reasons why we have Chinese people have a much more yellowish color. It's because we have a thick skin, and then we have to use thicker needles.
Also, isn't it all a cultural thing that when I was over there, patients were asking more manipulation to feel the qi sensation?
I think it's cultural things, because Dutch people are always asking, like, is it painful? Can I feel like? So I think it's cultural. To my experience, there is not really needed. There's no difference between reaching the qi, the sensation of the feeling, or just a needle, a small needle, just in it smooth in, and that's all. It has the same effect.
By the way, I was wondering, do you use fire needles yourself? Fire needling, the technique?
No, I don't use it, but I know it. So I know about 11 or 10 ways of doing treatment. You know, fire needle is one. There's one to puncture and to let it bleed. If it's bleeding, it is one of the best way to treat itching.
Yeah.
So itching, this is put the needle and let it bleed. That is itching.
Getting rid of the heat in the body. Actually, there were a couple of doctors over in Beijing University that were specialized in prick to bleed.
And there's another way of acupuncture is put the needle here in the bladder meridian, and no, not the needle, but you use moxa on the bladder meridian, and you have to cause a burning. You have to cause a burning wound, and let the patient come back in 5 days or 1 week, and it must be a pus.
Yes, that's correct.
If it is a pus, then it's okay. If there's no pus, you have to repeat the treatment again. And this way of treating is the best treatment for people with allergy, especially children with allergy. You will cause a pus, a wound, then 99% of the children will get rid of their allergy. Can you imagine what it means actually? Allergy is actually a distorted immune response. You are making allergic response. You are doing an allergic response to the wrong things. So if you cause a real infection, the whole immune system say, hey guys, we have to do a real problem. There's a real problem there. And re-divert all your resources. Don't do the allergy anymore. It's not important, the allergy of the nose. You have something more important to do. Is a real infection there. So you get the reset of the whole immune system, and after it has been treated, I mean, after the response of the infection, then the whole system we're back to normal. It's a Chinese research, and it shows a 99% effectiveness. Unfortunately, it's not allowed in Holland to cause an infection. At least I don't do that.
That's why it's also a really interesting topic, dermatology in TCM. It's really
some of these herbal recipes are secret formulas, but sometimes we think there is a little bit of corticosteroid use with these herbals.
Could you recreate the effect of corticosteroids by just using natural herbal medicine? Or is it?
I think yes, because the corticosteroid is actually a suppressive reaction. Intervention, but if you use herbals, and let me go back to another concept. You know, there's the animal kingdom and there's a plant kingdom. The animal kingdom, they have one law of life is stay alive. And the way to stay alive is to fight and to run away. If you're a plant, the same rule applies. Stay alive as a plant. But how can you run and how can you fight as a plant? So a plant has to look for another way to survive. And one of the way to survive is to produce chemicals. So a plant is one of the best chemical factory for survival and to fight. So if a plant is attacked by lice. A lice is trying to eat the plant, then it has to make a lot of chemicals to kill the lice, or to at least make it less attractive for worms and lice to eat the plant. And sometimes it's okay to eat because there's an interaction between the two, between the lice and the worm and the plant. So sometimes they will bring the seed away, they eat the fruit, but the seed will be spreaded. So there's a way that it is like a synergy. There's a synergy between the two.
Right.
And as you know that a plant can always make good chemicals to survive. And one of the things is like antioxidants. A lot of plants have very strong antioxidants. So I can imagine that if you use the correct herbals, the correct plants elements in your creams and herbals, then you might benefit from it. So I do agree that in herbals, there must be a lot of chemicals involved, which might have the same effect as corticosteroid, but is more natural. Although there's not everything yet clear at this moment, but at least this is a tradition of 2000 years. So that is actually a 2000 years long experiment with all the information we have. And that's something you have to take it into account, that even though you do not understand, the proof is there. The herbal treatment is based on experience and 2000 years experience, some 500 years experience. It depends on the formula. But proven at least more than 100 years experience. So even if you cannot explain why and how it works, the result is there. So consider this is a black box. You do the black box, something happens, and then the outcome. You know that the outcome is always related to the input. The only thing we at this moment do not know what happens in the black box. But the outcome and the input are quite, has a strong relationship that has been proven through all these decades, centuries of experience. So that is all one of the explanation I give to my patients. I cannot explain why it works and how it works. I only know it works. And to compare with that, like paracetamol, one of the famous worldwide medication for pain, nobody knows how it works. There's no scientific person who knows how paracetamol works. And still, people are taking worldwide a lot of paracetamol for pain. Some people even use it as a sleeping pill. And it works. But nobody knows how it works.
Yeah, and the thing is, paracetamol is also, you see it at the supermarket next to the chewing gum, and it's even cheaper than the chewing gum. Seriously, I've seen it. It's paracetamol is cheaper than chewing gum.
Didn't know that. Yeah.
But anyway, all this also somewhat proves the efficacy, not only the efficacy, but also the scientificness of traditional Chinese medicine, right?
Yes. Well, let's say the effectiveness of Chinese medicine has been proven, and it's only for a lot of Chinese treatments there's no good explanation for it. Especially if you wanted to do it in the concept of the Western way of explaining how things works. And for Chinese people, they don't care, because it has been proven centuries long, so it works. Why do you question it? And one of the things that's typical Chinese is that the scientific researchers tends to go into animal studies. For the Chinese, it means that if the animal studies prove that one of the herbals works, or acupuncture works, then that is the 100% proof that acupuncture works.
Mm-hmm.
If you use these research papers and show this to Western scientists, Western scientists would argue that, okay, you have now proven it works on animal studies, but it doesn't mean that it works for humans. So it's a different way around. In Western science means first you do the experiment, the research on animals, and if you have a positive results, then you have to do it with people. And in China, it's the other way around. We have done it on people centuries long, and as a final, we do researches on animal, and if it shows the same results, then we are ready.
Then it's proof, because and you already know it works on humans. So
because on humans it works, we all don't know why. Then we do it. We repeat the studies on animals, and say yes, it works. Then it is for us clear.
And what is your opinion on gold-coated needles? It's like you always read in books, history books, you know, at some point they preferred gold-coated needles because it has a different effect on the body.
Not from my experience, because I don't use these needles, so I cannot tell from my own experience. The body is like a battery. So as you have done battery when science class, you have a glass of water and you put some salt in it, and you do the copper plate in it, and you put the aluminum plate in it, and then you measure it, and there's an electric voltage in between. If you use, instead of copper, you use nickel, or you use another metal, then there's a different voltage. So I can imagine that if you use different needles with gold-plated or silver-plated or just iron needles or copper needles, there will be different electric potentials. So the different electric potential is something physical. What happens with the needling place? So I can imagine that different electric charges and electric voltage will induce a different response.
Okay. What about tubes versus non-tubes? Using a guiding tube for your needles?
Yeah. Well, the guiding tubes is a typical Western way of needling. Because the Chinese needling, you know, is you put you hold the needle in a specific way and you do this. This is the way of needling. And so we don't. If you are trained in the Chinese way of needling, you don't need the guiding tube. But on the other hand, I can imagine that the guiding tubes is less painful, because if you use a guiding tube, you have a tube, you press on it. The tube is pressing on the, especially if you press it on the skin, then people are aware of the gate theory. The gate theory means that if you have a sensation which is different than the pain sensation, then the pain sensation will be suppressed before it goes into the nerve system. That's the gate theory. So I can imagine that if you use a tube, a guiding tube, you press on it, that's actually you are activating the delta fibers. The delta fibers will be suppressing the alpha fibers. The alpha fibers is actually the pain fibers that will be stimulated if you put a needle in. If you put a needle in, you will feel some pain sensation. And that sensation will be suppressed by the feeling of the guiding tubes. There's another way to make it less painful, is just to pinch with one hand. With one hand, you pinch the skin, and you said, now I'm pinching you, and now I'm putting the needle in it. So people will only feel the pinching. They don't feel the needle anymore.
Yeah. Okay. And I was wondering also, you're based in, your clinic is in Amsterdam, Chinatown, Amsterdam, right? So the Amsterdam Chinatown, I mean. Was this coincidence, or did you deliberately say, I'm going to do my clinic in Chinatown, or?
It is coincidence because our family lives here in Chinatown.
Okay.
So it is a family home. So I think it's the best way to be in Chinatown to do acupuncture. And I only don't have a big sign. I don't put a big sign on it. I don't have a window with a sign on it like acupuncture. So people have to know my practice before they can come here. They have to make an appointment on beforehand. Like I said, like in China, if you want to buy antique, you go to the antique area, and that is a street with only antique shops. If you want to buy books, you go in Beijing to the book street. There's a street with only bookstores.
Yeah.
So I see this, like if you want to do acupuncture, go to Chinatown. There are many choices of acupuncturists you can choose between.
Okay, so you're happy over the nice concentration of.
Yeah, it's a Chinese way of working. The Chinese way of working is that all the antique stores will be together, and like so we make it. All the acupuncturists will be in the same area, so it's easy to find. So if people want to go for food or for acupuncture, then they only have to remember, go to Chinatown.
To finish it off, I already asked you this question, and you said you needed to think about it. Your favorite TCM book, and then you couldn't think of one, but probably multiple.
No, actually, I don't have one, because it's the same like my music collection. I don't have a favorite a singer of a band or something like that. I'm very eclectic. I buy too much. I have too much of these books. I buy many books, but one have to find the time to read it, especially when that is heavy stuff. But I like to go into the books and then to read the things I want to read at that moment. So usually if I have a problem, then I try to compare the what they are saying, different books. And I try to book 1, book 2, book 3, book 4. And then I will make up my own mind which of the 3, of the combination of the 4 way of treatments will be my treatment. So I'm not a person who said, this book is the best book, or I go for that book.
But that's good that you have a very scientific approach to reading books. You select on a certain topic, and then you compare them.
I'm always open for new ideas, and I'm not a follower. Like, this is my master, this is my teacher, I will my teacher. And it's like what a real Buddhist is, because Buddha said, do the good, leave the wrong, always try to find out what is the best, always study, don't believe anything, only follow your heart, don't follow anyone, not even me. That is the teaching of Buddha. That means that if you're a real Buddhist, you're not following Buddha.
I think on those words, that is a perfect ending to this interview. I don't think we could add anything better than that. I'd really like to thank you, Dr. Lee, again for joining us today. It was really interesting. It was fun also having this conversation with you, and there was so many insightful things also that we got to hear from you. So thank you again, and we'll hope to see you next time.
Okay, thank you for the opportunity, and thank you for the nice interview.
You're most welcome. Thank you.
You too.
Bye.